Hello everyone and welcome to another how-to video. Today we're going to look at the transfer of our patient and what that looks like in the orders workflow. So you already have your patient admitted, they're already on a few medications, they've gone for a procedure, in this case they've had a baby, and we're going to go into their orders functions and we're going to transfer them. So whether or not they're coming out of the operating room, transferring from one level of care to another, the workflow is by and large the same. You're going to click this transfer button, and within that transfer, the system's going to ask you what do you want to continue and what would you like to stop. After a time in a critical care or in the delivery room or in the operating room, your patient might have a bunch of orders on here that will no longer apply to them now that they're going to either a regular room or floor or perhaps even a lower or higher level of care. There may be medications and other orders on here that aren't applicable anymore. So what you'd want to do is continue whatever medications you would like your patient to continue on and stop anything that you want stopped. So we're just going to pick a few things. We'd like our person not to be on oxytocin anymore because they've had their baby, and perhaps they don't need these on their workflow either. So we'll leave them off, and they've already had their CBC, so we'll get rid of it. These are closed, but you may want to stop this on transfer. You might want to take a look at these other tabs to see if whether or not there's things in here that don't belong in here anymore. In this case, you may or may not want their pneumatic compression boots on. You may or may not want anesthesia still on record, those type of things. So then once you've established what you would like for this person to continue on transfer, then you're going to click the OK button. And that is going to continue all of these orders. And there are some areas that you will have to fill out. As this screen indicated, you're going to need a room type for this person. So you'll need to check the appropriate room for that patient. So in this case, we're going to select a regular room for our person, and then the reason for transfer, you're going to need to, you know, identify a level of care. In this case, this person no longer needs the delivery room. They're going to go to a regular room. There are some pop-ups that do come up every time you do a transfer, one of which is a consult. So let's just say you need to complete a consult or order an intensivist consult. Maybe this patient is going into the ICU. This gives you an opportunity to make those selections. And then every transfer is reflects a fall risk assessment for the nurse to complete once that patient has arrived, so that all that information is collected and the fall risk is appropriately identified. So I'm going to go ahead and pin my orders. And now my patient has successfully been transferred and they have all of the orders that they need for their care. Thank you for your attention and have a good day.